So speaking about longer innings, one thing that has often puzzled us in our pathways, as Akate very rightly said, is the exam factor. And whenever exams come up, there's always been this question between concepts and MCQs. And we've always heard people from everyone, like our seniors, also say that concepts are very important. But how important are concepts? Is concept building up like separate from MCQ building? Because everyone says if your concepts are good, MCQs to वैसे ही हो जाएगा. But should I take this with a pinch of salt, or should I always start MCQs separately from my conceptual building?
I think again interesting question, but what is concept? What is a concept? It is a loosely thrown word by winners for subsequent batches. I have heard this line as when I was, I still, but I'm always connected to my past, where I was, I always remember. So when I went in class 11th to a senior of mine who had passed the pre-medical exam, he said, concept बना ले. और मैं घर जाते हुए रास्ते में, and I'm from a very average family, so हम बस में जा रहा था जब मैं DTC बस में, तो मैं सोच रहा था ये concept है क्या चीज साला, बनाना है क्या? So and I've heard this in medical college also, I've heard this multiple times, but now when I look back, probably concept is a loosely used term for a set of rules. Once you understand them, you can apply it in multiple situations. I'll explain to you. Now, I have explained this in multiple of my classes when I teach them, like when I teach the students radiology. You would think that I would start by teaching them diseases and how to see them on a radiological image. But actually what I do is I break down the imaging into anatomy. And my first part of my class is always talks about how to look at the anatomy of the brain on a CT scan. Once I'm done with the 2 hours of anatomy, then I go on to pathology and I connect that, okay, because you're looking at a disease in the basal ganglia, probably this is this. You're looking at a disease in the midbrain, probably this is this. And when you are able to connect it, now what is concept? I want to dig deeper into it. We have two parts in our brain. One is conscious, which is the conscious memory. One is subconscious. Now, suppose you learn the anatomy of the brain and you learn the pathology and you learn the clinical aspect and you've learned all of them in different lectures. So they are as building blocks present in my subconscious. But you have not revised them before the day of the exam, so it is not in your conscious memory. But if you have trained your subconscious enough, on the day of the exam, it will come back. Because those dots will come back, it will connect. And that is what your senior was telling you, that if you build concepts, you can solve questions even if you don't memorize them. But the truth is, subconscious also needs to be trained. So if you, like your question was, suppose I don't do MCQs. So if you don't practice tests, if you don't practice questions, you have not trained your subconscious enough. I'll give you an example. A student recently, I was talking to a student, he said, sir, in my exam, there was a question which I had seen during my first MBBS in the dissection hall. And that question came back to me in the PG entrance exam. But I had not revised it. How did it come to me? Because it was there in my subconscious. So what is happening is we need to build our subconscious understanding by active learning. Active learning means questioning, answering, discussing, that is active. Only passively reading or passively listening will not build the concept. Actively engaging, building concept, and side by side training my mind to the power of subconscious by giving tests. So I have a very, very interesting thing that I thought I should tell you. Whenever you will give an exam, any exam, we all believe that the last 20 days or 10 days of knowledge will come handy. But that is not the truth. Actually, the knowledge of last 5 years is coming handy. You're like, साला ये मैंने पढ़ा कब था? ये कैसे याद आ रहा है मुझे? When I gave my PMD exam, I gave my PG entrance exam, I had an All India top 5 rank in every exam I've ever given in my life. Just because whenever I was giving my exam, I was like, यार ये मुझे याद कैसे? ये मुझे मैं क्यों कर पा रहा हूँ? And I have asked this to many toppers in the last 20 years. Every one of them says, somehow I'm able to do it beyond memory. So what is beyond memory is concept. What is concept? Concept is your subconscious understanding of the pathway. Just like, imagine you know how to ride a bicycle, but you've forgotten. You're not doing it now. But tomorrow there is a bicycle outside your hostel, you will be able to ride. It is there. It is there. I also have another example. Suppose you are going from your hospital to another place every single day. Okay. On the path, on the way, there are multiple shops that you've never actually gone to. Okay. But our mind has the ability to observe things. And suppose 1 month later I ask you about a shop that is there on the way. You've never been there, but your subconscious has observed, it will come out. That is concept. That our subconscious is observing building blocks all around. You are seeing things in the dissection hall, you're seeing things in the ward, in your textbook reading, in your college, in your coaching class. You are hearing multiple things. They're all forming your subconscious understanding, and people who are engaging in active learning are able to build more seamless concepts, and you train your mind to the concept to come back on the day of the exam. It has to happen on the day of the exam. Otherwise, the ranks and the results will not come. I'll give you an example. Like, what is the difference between a player or a cricketer who is the top category, like Sachin Tendulkar, Virat Kohli, or an average category? What is the difference? Is it only the talent? It is
Practice.
their ability. It is their ability to dig into their talent, rise to the occasion, and play the match of their life when it really matters.
Yeah.
So, what is the value of concepts is when you are facing a critical exam, a watershed exam in your life. Watershed exam means like your pre-medical test. Now, suppose when you were appearing for your pre-medical exam or your NEET UG, suppose you did not get through. It was a watershed. You would have been doing something else. It is a very critical moment. On those critical moments, are you able to rise to the occasion, apply all the understanding that you've got onto the questions that really matter on that day, and get a top score? This is how the ranking actually works. Nobody remembers everything. It is like what I've learned is it is the excuse of people who score less in any exam would always come back कि ये रट के आ रहे थे, टॉपर ने सब रट्टा मारा हुआ है. ऐसा होता नहीं है. It's like you need to apply what you know. So you will hear this line many times by toppers and students say कि the gap between knowing and applying in the exam really matters, and that is where those concepts fit in.